go ahead and get started as people come in. And so I think the only person on the call that I haven't met yet is Tiffany. Have I met Tiffany before?
She's in the office.
She was on. Maybe I have.
Okay. She was on my screen last time.
Oh, got you.
Yeah, okay. And then she joined that one time and it had like a weird name that we didn't know.
Okay.
Yeah, it put me as an Allison Cordova last time, but it was me.
I don't even know who that is.
That's very fun that you could be a different person every day.
Yeah. Right? I like to switch it up.
Why not? All righty, then let's go ahead and get started. Like I said, we have an hour, lots to get through. So we'll go ahead and get started. So I'm going to start by presenting from the browser version, and then we'll go into the mobile app, because from a CNA perspective or a home health aide perspective, the workflow for those folks is really easiest on the mobile application. However, you will need to know how to do some functionality in the browser version. So we'll go through that too. So Axxess is a software that is available on a browser. We do recommend either Google Chrome or Firefox. And we also have a mobile application. So just want to point that out from the beginning, that there are two different platforms for the same solution. So like I said, we'll start from the browser first, and then we'll move to the mobile application a little later. So you all should have received an email with an activation link when you were set up as a user within the system. And that activation link is where you would set up your username and password. But your username is actually your email that's within the setup when you were added into the solution. And you should be able to select that link to set up your password. So when you go to axxess.com, you will see a login button. When you select login, it'll take you to the login screen. I've already logged in today, so let me go back out here. It's going to bring you to the login screen here. This is where you're going to add your email address that was added in your user profile. If you do not remember your login password, remember you can select having trouble logging in, and it will send you a link to reset your password. Now, I know everybody on this call was part of the overview, but I know that some folks that are watching the video may not have been part of the overview call. So we'll just do a brief overview of the Axxess Planner. So when you log into Axxess, you will land on your planner. Your planner will look like this with these 3 columns here, and we'll go through this quickly what this information looks like. I do want to point out our Axxess training and certification modules here. Axxess training and certification does have some learning modules in there. So your organization may assign you some learning modules, or you are free to go in and look to see what's available for learning for training and certification. And there are some modules that do reward CEUs once you've completed that. So we encourage folks to take a look at that. Now, on your planner here, you will set up your location. I am in Florida, so that's why you see the Eastern time here. On the left-hand side here, this is where you're going to see any visits or shifts that are assigned to you on any given day, just depending on the day that you have selected. So today I have 2 home care shifts, which you can see here with this blue home care pill. Axxess does have other solutions. So when you see red home health, that is our Medicare certified solution. So we're looking at the blue for the sake of today's training. So these do tell you what the shift is, what the note is. This would give you a hyperlink to the client's chart. Anything that's blue will give you a hyperlink. You could start your documentation on the browser if you would like to. You also can see where those visits are located. So when you select a day, your map will adjust just based upon the location of where your clients are. So you can see these red dots here are where my clients live. You can also route your visits. So this will bring you to Google Maps. So you'll be able to see, how much time it would take for you to travel. Past due visits or any visits that have not been submitted by you yet. So this is documentation that I haven't completed. You can also create a missed visit from here. So a missed visit is a shift or a visit that was not able to be completed for whatever reason and was not able to be rescheduled. So you can do that directly from the planner as well. Our messaging center is our HIPAA compliant messaging center that's available, and I'll show you that from the mobile application. And then we also have our alerts. So these are any documents that have been returned from the Quality Assurance Center. So these are visits that I have submitted and they've been reviewed and they have been sent back to me. Now, if they have a red sticky note, the sticky note will tell you exactly what needs to be fixed on that particular document. Okay. So you can review it, re-sign it, and send it back to the Quality Assurance Center. Now, on the left-hand side over here, you will see a banner that says Home Care. Under Home Care, you will see your organization's name. And when you select that, it's going to take you into your planner. I was just in here a little bit ago. So it's going to take you, into your dashboard. So you'll see your name here and your organization's name over here on the right-hand side. I'm in my testing agency right now. So some of the areas that I want to make sure that you are aware of is that you do have access to My Account here. Now, under My Account Reset Signature, your electronic signature on the browser is a electronic signature. So if at some point you're trying to sign a document on the browser version, you will want to make sure that you have your electronic signature set up. If you go to sign a document and it won't allow you to sign, you will want to go to Home, My Account, Reset Signature, and this will walk you through the steps to send a link so that you can reset your signature. Okay. Also under the Home tab, you have My Schedule. So My Schedule, when you open this up, it'll give you a calendar or a list view, depending on how you select, of all the visits and shifts that have been assigned to you. So you're able to see anything that's been assigned to you for that given month, week, or day, just depending on how you are filtering that down. So that is under My Schedule. You also have the ability to go back to your dashboard and then My Messages. So My Messages, like I had mentioned earlier, is a HIPAA compliant messaging system within Axxess. So you are able to send and receive messages from anybody within your organization. So it does work pretty much like an email, but again, you're limited to those that are users within your solution. So you would select the message and you could just start typing in somebody within your organization. You could just start typing in the discipline or a tag, and that will bring up folks as well. You will need to make sure that you select the people that you'd like to receive your message. And then you've got your subject. You can select a client's name if that's applicable. It's not necessary. This will not be part of the patient record. You can request a read receipt, and you also can attach a file here if necessary. Then you would put the body of your message here, and then once it's sent, it's immediately sent to Crystal or whomever your recipient of the message is. Okay. You can filter between your inbox, your sent messages, and your deleted messages here at the top. Okay. And like I said, we'll go over this as well within the mobile application. At the bottom, just remember that as you open tabs, they will open here at the bottom, so you can kind of toggle back and forth. Okay. So this is just a way to kind of see your messages. The visits that have been assigned to you, just kind of overall. Now, your organization will be doing electronic verification for all of your visits. So it is when you are out in the field, seeing your clients, it is advantageous for you to use the mobile application primarily. Okay. At the very top here, I do just want to show you that there are different menu items here. So just depending on your permissions and your role, you likely will not see all of these items here. However, underneath under the client, you will be able to see your client chart. So when you click on the client center, you will be able to see any clients for which you've been assigned shifts or visits to over here on the left-hand side. Under schedule, you'll also be able to see my schedule. It's just the same one that we saw underneath the home tab. And you'll also be able to see the schedule center. And under the schedule center, again, you'll be able to see any of the clients that you have been assigned to. And you'll be able to see the schedule based upon that particular client. Okay, so we saw from my schedule, those were visits that were specifically assigned to you. And from the client schedule center, this is what the client schedule looks like. Okay. Now, just like we had seen from my schedule, you can list the tasks as well. So if you prefer to see these items in a list view, you can look at them in a list view as well. Okay. So also at the top, like I had said, you have multiple options up here, but they may change just based upon your roles and permissions. Okay. So I'm going to stop sharing. I'm going to go ahead and pull up my mobile application so I can show you what that looks like. Okay, let me go ahead and share my screen again. Okay, so I am sharing my cell phone right now. So what you will do is you will download the Axxess Home Care mobile application. It is available on iOS and Android devices. So just depending on the type of device that you have, you'll go to the Play Store or the App Store and you'll download this Axxess Home Care app. Now, it is the blue application. It's a darker blue color. You can see that we also have apps of different colors, just depending on the solution. So you want to make sure that it says Axxess Home Care and it is this dark blue color. When I click into the application, you are going to go ahead and log in to the application using the same email address and password that you use to log into the browser. Okay, so you will log in the same way. And the first time that you log in, you want to make sure that you have location services turned on within the mobile application. That will allow you to capture the electronic visit verification. And it also will allow you to use location services to find your client. Okay. The other thing that the app is going to do is it's going to ask you to set up a 4-digit PIN. So you can set up whatever 4-digit PIN you would like. It just acts as another layer of security on your device so people cannot access it and get into people's private information. Okay. One of the things that I also want to point out here in these little tiny numbers here, this 4.0.1, this is the mobile app version that I am currently using on my iOS device. Why this is important is that Axxess does mobile application updates regularly. So if you are having an issue with your mobile application, we will often ask, and your super users will ask you, what version are you using? Because if you haven't updated the app, it is likely that it's not going to be working correctly. So that's usually the first questions that we ask is what is the mobile application version that you're using? And is it an Android or an iOS? So this is one place that you can look to see which version you are using. Okay. Once you set up your PIN, you can go ahead and put your PIN in to log into the mobile application. You will come to the home page. So you can see here at the bottom, this is your menu here at the bottom, these items that you can select. We're going to start over here on the left in the home page here. Okay. Now at the top, you can see that we have 3 buckets. Okay. These are buckets in which your shifts and tasks have been put into. So the task or the shift is either past due. What that means is that it was dated before today and it was not submitted to the Quality Assurance Center, which means I did not complete my documentation for 9 shift notes or tasks. Okay. The second bucket is the QA return. What that means is I have 9 tasks in here that have been submitted. They've been reviewed and returned back to me for correction. And then I have 2 scheduled tasks for today. So you can see here, these are my 2 scheduled tasks for today. Okay, so we're going to go through these 3 buckets so you can see what they look like. So we'll start with the scheduled. Down here at the bottom, you'll see this route visits button with this rainbow gradient here. Using Axxess Intelligence, this does allow you to route your visits for any given day. So based upon the address of these 2 clients, when I select to route these visits, it's going to take me to a map and it'll show me the best route to get to these particular clients. Now, my office is in Dallas, so this is showing me driving from my office in Dallas to my clients in Florida. Not realistic, of course, but from demo purposes, that's why you're seeing it that way. So down here at the bottom, I can see that I have 2 visits with 2 locations, and I have almost a 17-hour drive. And then when I select directions here, it'll take me to either Google Maps or Apple Maps, and I'm able to kind of plot those paths, those addresses on the map itself. I'm going to go up here and select back. It'll take me back to that home screen. So up here, like I said, are my 2 visits that have been scheduled for today. You can see the client's name. This is the name of the task. So again, this is my testing site. And so my CNA note is called Implementation Custom Aide Note. Yours would say CNA Visit Note or something of that sort, okay? You then would see the assigned shift time here. And then you'll see this house. This is the electronic visit verification house. If the house is gray, it means the electronic visit verification has not been started yet. If it's yellow, it means it has been started. And if it's green, it means that it has been started, finished, and completed. Okay. The status of the task is right here. So what that means is I have not even started my task yet. I haven't even started documenting what I'm going to do with this particular client. Okay. So let's go ahead and select, I'm going to document on Sam today. Okay, so I'm going to click that particular visit and it takes me directly into my scheduled visit for today. So if I am at Sam's house, I just showed up. I'm at his home here on LaFleur Drive. I'm going to go ahead and select clock in. So when I clock in, it starts that timer. You can see that here. Okay, so as soon as I know that that visit is starting, I go ahead and select that green button that says clock in and the timer has started. Okay, now if I go back here, I just want to show you this. If I go back, see how my house is now yellow? So the office is also going to be able to see this. They're going to see that you are at Sam's house and that you started the electronic visit verification, but you're still there. It hasn't been completed yet. Okay, so if I go back here, there are a couple options when you click into this visit note. So my first option here is my client chart. So I'm going to go ahead and click into the client chart. The client chart is going to give the demographics of the client. If I select the info tab here, this is where I would see the client's phone number, their address. I could see their diagnosis, their triage level for emergencies, if they have any contacts, anything that I need to know about that particular client, I would see that here. If I select back here at the top, the next option is call. So this is a one-touch calling feature. So if I was going to either call to schedule, or maybe I'm standing outside of the client's house and they're not answering the door, I can go ahead and select call, and it's going to call the primary phone number on that client's chart. Okay, so that's a one-touch calling feature there. I also have the ability to find directions to the client's primary address. So this is really handy if you have more than one shift or task in one day. When you get in the car, you can pull up Sam's profile, you select map and hit Google Maps or Apple Maps, and it'll take you to that primary address that's in the client's chart. So it's very easy, so you're not having to type in the address into whatever map or GPS system that you use. You also will have access to the allergies and then any primary diagnosis that's been added onto the chart. You will be able to see the medication profile for that client. May not be something that you are, may not be giving medications, things of that sort, but any medications that are on the profile are available here. Any orders that have been written for that client would be under the orders tab. The visit history for this client would show here. So if there were any tasks that had been completed for this particular client, you could see from the visit history. Any physicians that are on the client's chart would be available here. This is a one-touch calling feature for that physician as well. So if you needed to call the physician for whatever reason, you could click this little phone icon and it will pop up the phone number for the physician for you to call. Caregivers, this allows you to see any case managers, clinical managers, and any other staff or users that have been assigned to this particular client. So if you want to reach out to the case manager or you want to know who is on that team, you can go ahead and select that and you'll be able to see them listed here. Contacts or any emergency contacts for this client. So this client doesn't have any emergency contacts, but if there were any, they would be listed under contacts. Pharmacies would list any pharmacies as well as a one-touch calling feature for that pharmacy as well. Any communication notes that have been completed for this client would be under here. So if you wanted to see, if there was any communication about this client that's on the chart, you can look there. Addresses for the client. So if you're wanting to see if they have additional addresses, maybe they're seeing, they have several children, maybe they move around from each child's house, so those are listed here. Any addresses on their profile would be listed here. And then any documents in the chart. So if there's any referrals or H&Ps, anything of that sort, you'd be able to see them within the documents of the chart here. Okay. When I come up here and I go back, the next thing that I'm going to select here is the visit note. Okay, so the central little button here, this is for the visit note. When I open this up, this is where I am going to document what I've done with this particular client. So you can see that I clocked in at 2:50 p.m. Again, I'm Eastern time, and that my visit timer has been going for 5 minutes. Each one of these tabs will open up, and you can see this indicated by the arrow on the right-hand side. When I select the arrow, it will open up that area. So I can view the care plan from here, which you'll be able to look at this from a PDF format. However, I will show you from your visit note, you'll be able to see that care plan directly within your visit note anyway. Any visit details here, so that's going to include your start and end time. Now, your company setup has been set up that your start and end time are going to reflect whatever your clock in and clock out time is. So even though my shift time is 8 to 12, I obviously did not get there at the right time, which is a no-no. But my start time and my end time are going to reflect my clock in and my clock out time. So yours will do the same when you log into your visit notes. Okay. You also, frequency of services. So if that was added into the care plan, you're going to be able to see that, as well as any vital sign parameters. So if you are supposed to be taking vital signs of that particular client, you will be able to see the vital sign, the parameters that were entered in the care plan. Now you'll notice that these are grayed out because these are read only. This is information for you so that you can know what to do with your particular client. Okay. Safety precautions for your client, those would be checked here. Again, this is read only. Any functional limitations that you would need to know about for your client would be under the functional limitations. Any activities permitted. So that would just give you an idea to make sure that Mr. Sam here always had his walker when he's up. Any care plan comments, if there were any, you would see those here. And then we go into the task. So vital signs. If you're taking vital signs for your particular client, you would open up the vital sign tab here and you would select this add button. When you select add, you will be able to add in the date and the time, and then the vital signs that were taken. So if you take vital signs several times throughout a shift, that's okay. You can just, every time you take the vital signs, you can go ahead and select add. And you can add them in on that particular time frame. So you would just add it as a different entry. So any of the vital signs that you took, any of the blood pressure, oxygen saturation, any of the above, you would go ahead and add those in. Once you've added them in for that particular time point, you would select save and close here at the bottom. And then you can see under my vital sign tab, here are the vital signs that I took at 2:58 p.m. Now, if I needed to take vital signs at another time throughout the shift, no problem. I could go ahead down here and select add again, and it would open up a new page where I'd be able to put the date and the time in which I was taking those particular vital signs. So you can take them as many times as you need to throughout your shift. Go ahead and delete this one so we just have one entry. The next tab that you're going to look at are your daily living tasks. So your daily living tasks are the tasks that you will perform with your client. So I'd mentioned earlier that you can see the care plan at the top of this visit note. However, your entire care plan is built into your visit note. So any of the activities, any limitations, anything, precautions, things of that sort are going to be built into your visit note here. So each task will be built out for you. So for instance, I am supposed to do a shower with chair with Mr. Sam, and the instructions are to use the master bath shower. For each task, you will be required, and you can tell by this red asterisk here that this is a required field. Did you complete this task? Your answers are yes or no. If you completed the task, it allows you to move on. You do have the ability to enter text here in this field if you have more information about that particular task that you would like to add. Additionally, the next task is shampoo. If you are to select no, you will be required to say why you didn't do the task. So why did I not shampoo Sam's hair today? And so you just have to indicate why that was not completed. Now, if you do have a mobile phone or a tablet that you're using that has a talk to text feature, this is a really good way that you can use that feature. So you can say, shampoo hair was not performed today because the patient's wife had already shampooed his hair earlier, period. So you can choose to use that talk to text feature in any of these text fields that are available as long as your device supports that. Okay. So each one of these tasks that are grayed out, you just indicate whether you did it or you did not. Assisted with dressing. Assist with ambulation using the walker. Light housekeeping. Meal setup. And just keep in mind that your tasks are set up within your company's solution to mimic those particular tasks that you perform with your clients. Okay, so they will all look familiar to you when you're opening up that visit note. You also have a tab here called comments. So comments, again, this is a text field. So if you want to talk to text in here or add any additional information, you can do that as well. And then any addendum that have been attached, I don't have any on mine, would be down here. So really this visit note is just the care plan that you're able to view, and then you just address each one of the tasks that you completed. Okay. Now, once you're finished with your documentation, there's a couple different options here. So collapsing all actually will collapse the entire note back to its original form. So as you start opening some of these tabs, you can choose to expand all or you can collapse all. It's really up to you. Okay. Now, in the upper right-hand corner, you'll see save and exit. Now, anytime in Axxess that you save, what that means, you should always think to yourself is, I'm going to save and come back later. So save does not mean you're submitting your document. It simply just means that you're saving it and you're going to come back and complete your documentation. So let's say you have a pretty lengthy shift, you're doing different tasks throughout the shift. You can go ahead and select save and exit. When you select save and exit, your clock will still continue. Okay, so you don't have to leave that visit note open. So if you save and exit, the visit's still open and your timer is still going. Okay. Once you have completed your shift, you've completed your documentation, with these notes, you really should be getting your documentation done within the home as you're doing the task that you're completing. When you're ready to leave the home and you're ready to get the client's signature, you select the button that says complete. When you select complete, it's going to ask you for the signature date and time. So we're going to go ahead and time this. And again, you have the option of save and exit, which means we're going to save and come back later, or I'm going to go ahead and hit complete. When I hit complete, it's now, I'm back at the timer now. So it's asking me to now clock out of my shift. So that shift that I started at 2:50 p.m., I now have the option to collect the client's signature, or I can cancel the task verification. So if I started a task verification and I ended up not actually seeing that client, I go in and they say, no, I don't want to see you today. You do have the ability to cancel that task verification, or you can go ahead and select to collect the client's signature. When you collect the client's signature, it is going to turn your phone to this configuration here. And you have the ability to select them to collect the client's signature, or you can select if the client is unable to sign. So if the client is unable to sign, let's start here, okay? You can select why they are not able to sign, physical, mental impairment, or other, okay? So I'll just select physical impairment for now. And then you have the options here to either collect a client voice recording. So maybe the client is not able to sign, but they can give you a voice recording saying that you were there at the house on June 30th from 2:50 p.m. to 3:05 p.m. Or you can have their caretaker sign. So if they have somebody in the home that's willing to sign for you to be there, then you can go ahead and do that. Okay, so if you select that the client's unable to sign, you do have the ability to collect the voice recording or collect the caretaker's signature. Okay. I'm going to go ahead and select the back button up here just to go back to where we're collecting this here. So I'm going to select collect client signature. And then I'm going to select collect client signature again, because Sam is able to sign for me. Okay. Now from this point on, this is for Sam to say that he confirms that Jill was there today and confirming the date and time that the visit occurred. And then Sam's going to go ahead and finger sign on your device. Okay. You do have the ability to clear the signature to try again. Once the signature is collected, you'll go ahead and select submit. Okay. Now it's asking to collect the staff signature. So that's you. So you've collected your client signature, then you would collect your staff signature, you would sign, and you would select submit. So on the mobile application, your signature is a finger signature. Okay, you don't have to have an electronic password that you're typing in. You just simply finger sign the device. Okay. Once you select submit here in the upper right-hand corner, you'll submit again down here at the bottom. Hit OK. And oh, it's saying that my shift time's not between the time there. So the signature time will be collected, and then you'll go ahead and select complete. Okay. Once that visit is completed, I'm just going to go ahead and close it here. Save and exit. You'll see down here at the bottom, here is the client signature and my signature here. Okay. When I select this visit verification, it shows that I was at Sam's house from 2:50 to 3:07, got both of our signatures here, and it shows exactly where I was. And you must be within 1,500 feet of that primary address in order to capture that signature. Okay. So I'm going to go back here to the visit itself. Some other things on the screen that I wanted to show you are also the missed visit option. So if the visit was not able to be completed, you are able to mark the visit as missed. Now, again, the missed visit could be it's a visit or shift that is unable to be rescheduled. So this is the way to track that and to say what is the reason that we did not complete this particular visit. That will also take it off of your schedule. So it's not on your assigned list anymore. It'll go to completed. So those missed visits will be completed. Again, if it's a shift that is unable to be rescheduled, and you must mark it as missed. Okay. Also down here at the bottom, you can see there's visit comments and care period comments. You always want to make sure that you take a look down here, because these visit comments and these care period comments are added to tasks and your client charts to communicate certain things to you about that client. So there may be some messages down here on these comment sections that you want to take a look at. Could be things like gate codes to their communities, or checking if they have something in the home or something of that sort. So just some type of communication between the office staff and you. Okay. All right. I'm going to go ahead and select back up here. When I go back, you can see now that the house is green. And this green house means that my electronic visit verification has been captured. Okay, so that's how I know if it's been captured or not. Down here at the bottom, I'm going to quickly go through some of these. We've kind of gone through them already, but I'm going to go ahead and just show you a different way to get here. From the Clients tab, this is going to be the way that you can get to client charts that you have any tasks assigned to you. Okay, so these are, for instance, here's Sam. When I click on Sam, it's going to take me to his chart. So it's the same chart that we saw when we went into the actual visit, but it's just a different way to get there by going directly to the client chart here, okay? You also have your schedule tab here. Now from the schedule tab, you're able to see the tasks that are scheduled, that are completed, and any that are returned for review. So you're able to see those tasks here. Now, if I select this little arrow, I also can see the, different tasks that are in different statuses here. So we can see past due, QA returned, scheduled, or completed. Now these buttons here, these clouds with an arrow downward, these are the ability to download your visits to the mobile application. So with Axxess, you are able to download your visits to the mobile application, and we recommend that you do that each morning, either before you leave home or when you are in an area where you have either Wi-Fi or data connection. When you download those visits to your mobile application, what that means is that if you go to an area with poor service, you still will be able to document. You could put your phone in complete airplane mode and you still would be able to go in and document on your visit note. So having no service should not slow you down in completing your documentation, okay? You also will be able to capture electronic visit verification, even if you don't have service, because the electronic visit verification is done through satellite, okay? So you still should be able to capture that information regardless of the type of service that you have, okay? So to download the visit, if you click on that arrow, those clouds, that blue cloud will turn green. So that is one way to do it, okay? The other way is if you go to your menu here, you do have this button here, and you could just select it to download all your visits. And what that'll do is it'll download visits that are available and scheduled to you. So on a daily basis, your workflow really should be that you log into the mobile application, you select that menu button, and you download your visits onto your mobile application, okay? I go back to my schedule tab, we'll now see that that other visit is now downloaded here. Okay, so I would be able to document this with no service. Now, one of the things that you may notice as well, and I want to show you this because if you come across this, you'll need to know how to navigate it. So if I click into this visit note for this client, you're going to see here that it says that I'm not able to clock into this client's home because I am not near the client's home. I am not within 1,500 feet of this address. Okay. So your clocking in and clocking out, like I said, is directly correlated to that 1,500 feet from that primary address. Okay. So you're going to see this here. Additionally, when I click into the visit note here and it opens up, the very top, see how it says there's no associated care plan here? What that means is that the person that is creating the care plan for this client did not complete it. So what that means is that I don't have any tasks to document from. And it tells me that right here at the top, that there's no associated care plan. If I go down to the daily living tasks, you can see that there's nothing there, okay? If this happens to you, if you go to open your visit and there are no tasks associated, you need to call the office and let them know that you need to have the care plan created and submitted to be able to see the tasks, okay? So this just means that there's some work that needs to be done from the office side or from the nursing side to make sure that you have that care plan, okay? All right, I'm going to go ahead and hit close, and we're going to go back to this screen here. The other thing that I wanted to show you was the QA return tab here. So from the QA return tab, again, these are tasks that have been returned for you to make corrections. Okay, so it is returned with clinician signature, so you can see that here. You're also going to see this little text bubble, the yellow text bubble. When I click that, it opens up a note here. And what it's telling me is that I need to add vital signs to my visit note. This is a shift that I did on June 17th, and I did not document my vital signs. And so when I submitted my documentation, it was sent back to me by the QA person telling me that I need to go ahead and add that. So what I would do is I would go ahead and click into this visit note, and I would add my vital signs and submit it back to the Quality Assurance Center for review. Okay, so it's important that you're taking a look at this QA returned bucket, because these are going to give you the reason why they've been returned to you. Now, you should anticipate that some of your documents are going to come back to you, especially as you're learning the solution. That's very normal. But just make sure you're paying attention to that. And if you get a call with, hey, I sent back some notes to you, check them out, this is where you'll find them. It's under the QA return bucket. Okay. You also have the message center on your mobile application. So the messaging center, like I had mentioned, is a HIPAA compliant messaging center. You will be able to send and receive messages right here from the mobile app. So if I go to the sent bucket here, you're going to be able to see that test message that I sent to Crystal from the browser. So it looks exactly like it does on the browser. Okay. This pen and paper icon is what I would select to create a message here. So if I want to go ahead and create a message, I'll go ahead and hit plus here. I'll go ahead and send it to Crystal, and I will add her name here. Crystal. You can select a client's name, again, if that's applicable, and then put a subject here. Skin problem. Maybe there's something that I want to let the RN know about this client, that there's maybe an issue with the skin, okay? Something that's new. So I'm going to go ahead and select Sam, and you can type in your message here. Sam has a new rash on his right arm. Done. All right. So you also have the ability to add an attachment here. So the nice thing about that is when you're out in the field, if you have a device that takes photos, you can go ahead and take a photo of the rash or of a paper or anything, and you can add it to the message itself. So I'm going to go ahead and select to take a photo. I'm going to take a photo. I'm going to take a picture of Sam's rash. It's a funny looking rash. And then I'm going to use the photo, and then it attaches to the message itself. And then I'm going to hit send, and I'm going to send this picture to Crystal to let her know that Sam's got a weird rash on his arm. It looks like an octopus. Okay. So now it shows that I have that sent message, and she can take a look at that. So just know you have the ability to send messages back and forth, and pictures, files, things of that sort. Okay. And last but not least is the menu item. So we went there before to download our visits. You also have the ability to set up an electronic ID badge if you would like to do that. You will not need to do the employee COVID-19 screenings. You can select an incident log here. So if an incident occurs with your client or with you when you're out in the field, you can go ahead and select a new incident. And the incident reports can be because of your client, or it could involve you. It just depends, on the situation. And the types of incidents are selected here. So you can go ahead and document those. Again, anything in Axxess that has a red asterisk is a required field, and anything that has a colon after it will open up for more information. So if you say that there is a fall with injury, that it's going to ask for more specific information. Where did the fall occur? What was happening at the time of the fall? What was the type of fall? and any other issues. So then you can also indicate if there was a medication issue or a near fall, etc. Okay, so you can fill out this incident log, and then that incident log can be submitted. Remember, save and come back later, or complete to submit to your team. So those are the incident logs. You also have some setting options, just depending on iOS. You can turn on Face ID if you would like to. We have a help tab here. The help tab will bring you, if you forgot your password, you can reset that password here. And then the calling feature, this would bring you to our client success team. However, you do have super users within your organization. Lacey, Lindsay, Julie, and Kathy have all gone through the training with Axxess. So they're your first person to contact if you're having some type of an issue with Axxess, okay? If you're not quite sure of the workflow or how to do something, you're going to want to contact them first. And then they will reach out to us if there is an additional question that needs to be asked, okay? And then log out, of course, that's pretty self-explanatory to log out of that mobile application. Now, just know if you lock your phone, the next time you pick it up, you will need to put in that 4-digit PIN to get back into your mobile application. All right. Are there any questions about the workflow that I just showed? Makes sense?
I'm good.
Okay. All right. Good. All right. So like I had said, if you have any questions as you start using the solution, you will start seeing skilled clients in Axxess on July 6th. So at that time, you may have some clients using Axxess that you'll need to document within Axxess. So just reach out to those folks within your organization, and then they can reach out to us if it's something that they're not able to answer for you. Right. Any other questions in general about the workflow I just shared?
Just if you'll get that recording to Monday and the ones from last week, I can get them to the right people.
Okay. Yep, we will do that.
Thank you.
All right. Go ahead and stop recording.